Well, I've had many people come to the office and they talk about a lifetime, honestly, of cold teeth and chronic. Sometimes even one tooth might spur up and have a chronic cold, and it'll be for several days and it will go away. Multiple reasonings behind that. One thing is that our jaws are full of blood vessels and it needs to circulate within the bone. And whenever there's a constriction of the blood, it can create that feeling like when you go outside and you get frostbite in your hands and you come back in and it just tingles. It can create that sensation in the teeth, and therefore you get that cold, that real cold sensation. The things that can trigger that: clenching. The average pounds per pressure on the teeth, 350 pounds of pressure are on the back teeth when you chew. And when you are a clencher, especially the gentlemen that are very strong jaws, be clenched down, that compaction in the bone can actually cause the vessels to reduce. And that's a classic sign for us to investigate and find out what we might be doing when we sleep. It could be clenching. The other things can be actually just the open areas on the teeth, you know, root exposure. Teeth are made up of what we call tubules, little straws that have fluid in them that run from the hard enamel side, which is like porcelain, no sensory, into the center of the tooth that would be a nerve. And if this is open and does not have the calcium and the phosphorus and all the things that seal up that openness, anything that touches it, especially acid and toothpaste, things that can have a drawing effect, will push the water, the fluid, through the straw and it will hit the nerve, and that can create a really like a shocking feeling, cold especially. So that is times where we talk about things to seal the outside, but what creates them to be open? Is it the gastric reflux that you're struggling with the acids? Because the acids will erode the outside of the tooth. In the summertime, are you really just doing a whole lot of lemon in your water? Those are things that are concerning because it can take away some of the protection from our teeth. And we have, you know, that's some classic things that can be used in order to get that calcium, phosphorus, all of that stuff to get back into the makeup of the structure. But that has a lot to do with cold. One other classic thing is, especially when it is in the upper areas in the back, are sinuses. Sinuses are wrapped into those roots. If you were to take and do a scope and you would be able to look into those sinuses, you will see little root tips many times sticking up or protruding into the sinus cavity. And therefore, any irritation of sinuses, getting a little cold, allergies, kicking up, the flaring of that very delicate lining in the sinuses can create the nerve in the tooth to be inflamed, and therefore we come in for toothaches, but we walk home with a different thought of the source. Another beautiful herb that I work with oil of cajeput. It works on everything, cold and sinuses and even mosquitoes. So even things in the summer, you never have to deal with mosquitoes again with oil of cajeput. So little secrets, simple.